Good morning and welcome to Louisville Mayor Greg Fischer's COVID-19 press briefing. Today is Tuesday, August 17th, 2021, and this is Jessica Wethington, Deputy Director of Communications. Today you'll be hearing from Mayor Fischer, Dr. SarahBeth Hartlage, Associate Medical Director with Louisville Metro Public Health and Wellness, Dr. Paul McKinney, Professor and Associate Dean with the University of Louisville School of Public Health and Information Sciences, and member of the CDC Advisory Committee of Immunization Practices, and Dr. Mark McDonald, Medical Director of Norton Children's Hospital and Pediatric Care Physician. I'd like to remind everyone to please mute your devices and place your questions in the chat addressed to everyone. Thanks, and we'll get started here in just a few seconds.
Well, good morning, everybody. Greg Fischer here. I think everybody knows that our community is firmly in the red alert status for new cases, and we're seeing frightening images from around the country, especially the South, about hospital beds filling up and the virus condition being worse than it ever has been. I know it's hard for us to believe this is where we're at, but we certainly are here. You're going to hear more about our local numbers and our local situation in a minute, but I can tell you that the new cases in our city now are comparable to mid-February, back when vaccine supplies were limited. And of course, over half of the population is vaccinated now, so it makes it even scarier for people that are not vaccinated. Back in February, much of the community could not wait for supplies of the vaccine to be opened up, and they did, and people got the shot, and vaccinated people drove down the numbers quite significantly, because we know that more vaccinated people means fewer opportunities for the virus to infect and cause serious illness and death. And more vaccinated people meant we could safely reopen the economy. But, and that's a big but, as it's done in communities across the globe, the virus had other plans for us. We've always learned to stay humble to this virus, and it's showing that once again. The Delta variant, clearly much more infectious than the previous version of the virus, is driving the tragic spike in new cases, largely by finding the unvaccinated. The unvaccinated are bearing the brunt of new infections and practically the entire load of serious illness. This is a personal issue for everyone, but especially people who have not gotten their shots. And this really is important when you think about our youth, because remember, children 11 and younger cannot get the shot yet. We're going to hear from some of our friends at Norton about the trends we're seeing with young people in just a few minutes. But everybody, especially parents and caregivers, please listen. You may be living your life on the assumption that COVID-19 doesn't infect young people, or that children aren't being hospitalized with virus. Those assumptions now are very outdated, and they're just flat out wrong. It's one thing to make a decision that puts yourself at risk as an adult, but now we're talking about our community's future with our children. We're talking about your kids, your friends' kids, your neighborhood's kids. Everybody is possible to get the virus. So please keep that in mind if you're on the fence, right? And it's understandable if you still have questions about vaccines, but please bring your concerns to a doctor or pharmacist as soon as possible so you can get those questions answered. And talk to your vaccinated loved ones also to hear about their experience. And if you are vaccinated, please today pick up your phone and tell someone you know who is not vaccinated about your experience to remove any fears or questions that they might have. I can tell you, for me and many people that I spoke about, just getting the vaccine is getting like a ton of bricks off your shoulders, where you don't have to worry as much about the virus coming for you. So please share your experience with other folks that you know. Uh, while you may walk into a store or office knowing that you've got peace of mind, someone in the room may be infected, you have a high level of protection against serious illness and death, and especially if you put a mask on top of your vaccinated condition as well. So let's dig into our local numbers. Let's hear from Dr. SarahBeth Hartlage, one of our great leaders in Louisville Metro Public Health and Wellness, about the latest data. Dr. Hartlage, what do you got today?
Thanks, Mayor. So Just like the rest of the US and the rest of Kentucky, as you said, we're seeing exponential growth in COVID cases. And the very contagious Delta variant is now our dominant strain in the area. And with Delta, one infected person can infect 5 to 7 more people. So with that said, as expected, we do remain in the red zone, as we said. We had 2,226 new cases confirmed last week. For an incidence rate of 41.5 cases per 100,000. Keeping in mind that the cutoff for the red zone is 25, so we are now pretty deep into that red zone. We had 12 new deaths reported last week, and I do want to note specifically that when we look at these deaths, we're seeing younger folks who are dying from this disease than we've seen in the past. Of those 12, 5 of them are under 50. Including 2 who are in their early 30s, which is really sad news for all of us. You can see from the curves that our deaths, our cases, all are trending upward. And we know from our previous experience with this virus that hospitalization numbers and death numbers do tend to peak a few weeks after the case numbers. So we're definitely still on the upward swing for those curves right now. Taking a look at the vaccine data, the good news is we've given nearly 900,000 doses here in Jefferson County, and 453,000 folks have received at least 1 dose of the vaccine, which is 59% of our population. We do have about just shy of 400,000 people, 392,688, who have completed their vaccine series for about 51% of the population. We, in general, have seen an uptick in vaccinations over the last month or so, with people maybe having some concerns about Delta, wanting to go out and get vaccinated. Last week's numbers were actually down just a little bit. So just another reminder to reach out to somebody that you trust to talk about your vaccination status if that's if that's a step you haven't taken yet. We do have vaccinations spread across the entire city. There are many, many places to get them now. We do still have a higher density of vaccine uptake on the east end than the west and south end, but happy to see some vaccine numbers continuing to rise, especially in those lower density areas. Our hospitalized patients, for the past week, we've had around 250 patients in the hospital, with about 75 in the ICU and roughly 50 on the ventilator. Note that these numbers update at 11 a.m. So that little downtick you see there at the very end for today, that number will update here in about an hour, and we'll expect to see we expect it to be consistent with what we've seen over the last week. And then looking at our demographics, in terms of race and ethnicity, the highest raw number of cases remains in our white population. But we do still see an outsized effect on our Black and brown communities, many of which are in those West End and South End areas with lower vaccination uptake. And then, as I mentioned before, we do see a disproportionate number of cases in our 20 to 40-year-old age group. Can we click on that past 8 weeks for the age graph there? Yeah, so you can see our 20 to 40-year-old age group that has quite a few more cases than you would expect from the segment of the population that they recommend or that they represent. And then we are still seeing an uptick in the 20 to 44-year-old age group there. The blue line continues to go up. So that is the population that we have the highest concern about. You know, when we talk about the vaccine data demographics, we've got more vaccines still in our 70 plus age group. They jumped out to an early lead in January and never relinquished it. But I will say our folks under 40 who may think that they are not at risk for severe illness, I hope that seeing how many of these people have been hospitalized and including some recent deaths, that maybe people will decide to go and get vaccinated. When we talk about our Delta variant, we often hear it compared to chickenpox in terms of contagiousness, with that one person being able to transmit it to 5 to 7 other people. And one thing to keep in mind is that we have a vaccine for chickenpox that's very effective, right? So the Varicella vaccine prevents chickenpox. You get 2 doses as a child. And it was introduced in 1995. So my generation is probably the last one where 95% of us got chickenpox as small children. And in the years since that vaccine was introduced, that incidence has dropped by 97%. And much like the chickenpox vaccine and the COVID vaccine, they're both very effective at preventing severe illness, hospitalization, and death from the viruses that they work against. So it is a good comparison. Remember to keep using those layered protection strategies that we've been recommending for nearly a year and a half now. Stay home when you can, and when you can't, please wear a mask and maintain social distancing. The most important step you can take, though, is to get vaccinated. Kids under 12 still do not have that option. And so when you get vaccinated, you're helping to protect not just yourself, but also the children in our community. So I continue to recommend that even if you've had COVID, even if you think that you're not at risk for severe disease, that you talk to your doctor, talk to your pharmacist. If you've not gotten vaccinated yet, now is the time. Plenty of availability out there. Go out and get your shot. Thanks, Sarah. Back to you.
All right, thanks, Dr. Hartlage. So moving to our next topic here, just in the past few days, the CDC and FDA approved and recommended COVID-19 vaccine booster doses for certain populations, particularly those that are considered immune compromised. So to help us better understand that, Dr. Paul McKinney joins us today. Dr. McKinney is a nationally acclaimed expert on epidemiology, immunizations, and emergency preparedness and response. He's a professor and associate dean in the University of Louisville School of Public Health and Information Sciences. Dr. McKinney also sits on the CDC Advisory Committee of Immunization Practices, which develops recommendations on the safe and effective use of vaccines to control diseases in the U.S. Dr. McKinney, we thank you for your national contribution and helping us locally here as well. But this is obviously big news, and we're expecting an announcement soon recommending all Americans get a booster dose. So can you kind of sort out all of what's going on with this for us?
First of all, thanks, Mayor Fischer, for inviting me today. I'm happy to be here. I think the announcement last Friday is an important breakthrough for all Americans who have a high-level degree of immunocompromised situations going on. The concern was that the additional doses of the mRNA vaccines really should be targeted first at people who were unlikely to have had a good primary response to the vaccines. And among those with immunocompromising conditions of a severe nature, it's estimated that maybe around 35 to 40% of them only had developed a primary antibody response that would be protective against the coronaviruses, any of the variants that are in circulation. So these individuals, if infected, will harbor the virus for longer periods of time. They can transmit it to a lot of folks, and there's a greater chance that mutations develop as those viruses continue to multiply in their system. So it's important that they be protected. It's also noted that of the individuals who are hospitalized now with breakthrough cases, about 40 to 45% of those individuals actually are immunocompromised. So these are folks who probably did not get a good response to the first round of vaccine doses. So this dose 3 now that's being authorized for them should help markedly improve their antibody response. It's estimated that instead of having 35% of that group covered, it should go up to around 70% with dose 3. Won't get everybody, but we'll make a very important increment in the level of protection for those folks. And the conditions that are considered to be immunocompromising felt to be those that are roughly equivalent to an organ transplant. So people who've had transplanted kidneys or livers, certainly hearts, stem cell transplants, who are on cancer chemotherapy, who have been immunocompromised since birth with a hereditary condition. Situations like that, those are the folks that are being targeted. not individuals who might say, it takes me an extra day or two to get rid of a cold than it used to. That's a low-level situation that really doesn't qualify here, but it's the really high-level immunocompromising conditions that are being targeted. How many people are affected? It's estimated that around 2.7% of the adults in the U.S. have one of these conditions, or about 7 million adults. And that will be an important group to go after here in the near term. The people who are authorized to get vaccine are individuals 12 and over who have one of these conditions, and they can be, getting these extra doses as soon as possible, as soon as they can, get to their vaccine provider. The other thing you mentioned, Mayor Fischer, was the additional doses of vaccine for people who don't have one of these conditions. What about other groups of concern, the elderly, nursing home residents, frontline healthcare workers, et cetera? There are some recent data that tend to show perhaps a decline in efficacy in preventing symptomatic disease among people who've gotten vaccine. These are data are being looked at very carefully. The protection against hospitalization and mortality are still quite high, no doubt about it, but protection against symptomatic disease, that's beginning to drop off a little bit at around 6 months or so in people who've had the mRNA vaccine. So I think there'll be reconsideration of that additional dose for those individuals very soon. I would expect in the next month or so, perhaps a couple months, but pretty quickly, that will be an offering as well, but not today. That's not the announcement for today. It's the focus on the immunocompromised. So hopefully all those folks will be getting the message either directly or through their healthcare providers that now is the time to get immunized. That should help overall with a number of hospitalizations that are occurring and reduce the burden on our healthcare facilities here in the U.S.
Mm-hmm. And Dr. McKinney, has that been widely reported? I mean, there's been a lot of focus on breakthrough cases, but I haven't heard as much about almost half of them being immunocompromised. So is that new data that's coming out, or have I just missed that?
I think it's something that has never been emphasized and never been, fully evaluated until this point. Now that there's been kind of a resurgence with Delta, and people are paying attention to what the situation is, that data has begun to emerge. It really has not come out with any kind of emphasis before. It was the first, in fact, that I'd heard of it at their meeting last Friday. But that number, 40 to 45% of hospitalized folks with breakthrough being immune compromised, that's a big number. And that tells you that the vaccine is not a bad vaccine at all, but the hosts who are responding are not able to mount an immune response normally, many of these individuals.
Yeah, well, that's good. I think that will help kind of build confidence again in the vaccine for people that were wanting to poo-poo its effectiveness because of the breakthroughs here. So can you explain a little bit about the booster itself? Is it a different formula than the existing 2 shots?
So this booster dose, or this third dose really, for the immunocompromised, is the same entirely as the original doses, the same in the amount of RNA that's present, the same in the volume of the injection. It's not modified to further focus on the Delta variant, but the studies that have been done by the pharmaceutical companies show that it does induce a really brisk response, a very major increase in antibodies, and that it does have a spectrum of coverage that will include the Delta variant. So I think over time there will be modifications of the mRNA vaccines, but the plan now is to use the same one because it looks sufficient for the present time to provide protection that's needed.
Okay. And then you talked about the RNA based vaccine. What about the J&J vaccine?
Yeah, so there are fewer individuals who've gotten their series with J&J. It's estimated around 12 million or so folks been vaccinated there, and then a small percentage of them, relatively, are immune compromised. But the data are still being evaluated there. There's no recommendation yet for what to do. That'll be forthcoming, hopefully soon, once the data are evaluated. But those folks seem to have, at least among the non-immunocompromised individuals with J&J, they have a response that persists probably for at least 8 months. So they're overall in good shape. Among the immune compromised, we'll just have to wait a little bit longer until a recommendation comes in. Those folks should not worry right now and should not rush out to get an mRNA vaccine. They should just sit tight, hopefully for a short period of time while the additional data are evaluated.
Gotcha. Okay. Well, if you could hang with us for a little while, I'm sure there'll be some questions for you from the media, but thank you, Dr. McKinney.
Thank you.
Okay. Just this past week, JCPS went back to school, and I had the pleasure of joining Dr. Polio and many hardworking educators and students for the first day of classes at Knight Middle School and St. Matthew's Elementary. And it was great to see learning in action, and everybody, the kids have no problem with their mask on. I think this is more of an adult thing. But it was a stark reminder that young people obviously are really susceptible to the virus, as we know. And it also reminded us that we've got to each be taking steps to protect our students, our kids, because obviously their health should be our top priority. And because the highest quality learning happens in classrooms, we want to keep kids in class if at all possible. Nobody wants to see the schools closed again. So joining us now is Dr. Mark McDonald, the medical director of Norton Children's Hospital and pediatric critical care physician who practices in the pediatric intensive care unit. He's seen and cared for young patients at Norton during the pandemic. His specialty in pediatric critical care and firsthand experience brings a really unique perspective. So, Dr. McDonald, thank you for being here with us today. And if you could just kind of describe your experience from the beginning of the pandemic to the changes you're seeing now and just provide context for us, it'd be appreciated.
Sure. At the beginning of the pandemic, the virus really hit the adult population, and it really spared the pediatric population. So during the height of the previous spike, we had approximately 2 to 3 inpatients total in the entire hospital, and maybe 1 ICU patient. During this spike of the Delta variant, it has really hit the kids a lot harder than the previous spike. So this morning we had 11 inpatients and 4 ICU patients. In general, where each day we get about 3 new admissions of COVID patients, and we're able to discharge about 3. So we're hovering a census around 8 to 13 for the last couple weeks. The patients are much sicker with the Delta variant, and they're requiring a lot more support than previously.
Well, we're fortunate now. I guess we know a lot more about treating the disease than what we did before as well. So if this had been at the beginning, we would have been in real trouble, I suppose.
Yeah, correct. We've put together guidelines really for treatment and distributed them throughout the state for pediatrics also.
Mm-hmm. And have you found any particular communication techniques that have been more effective to kind of alert adults to the danger of young kids and the virus?
Yeah, that's a good question. We're trying to promote vaccination. All of the children that we have in the hospital, about half of them are above the age of 12 and half are below the age of 12. None of them have been vaccinated. And these children can definitely spread the virus to adults. So again, your message about vaccination is so important, but it's also important to the pediatric population. And if you have children, 12 and older, you can get the vaccine for them. And they're really, we promote it as much as we can. We have vaccination centers for the kids. And we're actually going to start vaccinating children within the hospital that are admitted, that are not vaccinated, and offer it to their parents also.
Excellent, excellent. And then are you getting any of the stories of, I wish I would have gotten my child vaccinated? What are you hearing from adults?
Yes, we do get that message also, and it's a tough message to receive, but the best we can do is, try to get the word out there to the public to get vaccinated now as soon as they can. And, we don't want to hear that. It's just too late when you get to the hospital and you haven't been vaccinated.
Yeah. And of course, we're seeing kind of the long hauler complications with adults. And I know there's been fewer cases of kids to start with, but is there a same concern with youth as there is with adults with the long haul complications?
Yeah, absolutely. We see the same things we see with some of the other viruses in the community. So some children have myocardial dysfunction after having it. Some have fatigue. Some have fogginess with memory, headaches. I've even seen a couple with accommodation, meaning they're unable to focus, on when they read. So the virus has affected the ciliary muscle, and they can't focus anymore. So hopefully this goes away with time. But we're seeing some of the same effects of the virus that we do see in other viruses that we have a lot of experience with.
Mm-hmm. And Dr. Sarah Moyer's popped on the scene here. Dr. Moyer, of course, runs our public health and wellness department. Is one of her distinctions. Her other distinction, or one of her other distinctions, is a mother of 4 young children. So, Dr. Moyer, do you have any questions for Dr. McDonald here?
Thanks, Mayor. No, just appreciate you being on and sharing the message. I know there's a lot of misinformation out there about parents being worried about vaccinating their kids. Is there anything you can say to counter that or help encourage more parents to get their kids vaccinated?
Yes, I would say that the messenger RNA vaccine is so advanced and such an incredible vaccine that even the mild side effects that we see produced in kids, and I know there has been some discussion about cardiac involvement, but the cardiac involvement, the prevalence of that happening after the vaccine is 100 or 1,000 times less than the prevalence if you get the virus in the community. So it's much, much, much safer to get the vaccine, and it's such a low percentage of patients that the benefits outweigh the risks to get the vaccine.
Mm-hmm. I know we're talking about kids here, but last week an announcement was made about women that are pregnant and a recommendation on the vaccine. So I don't know if one of y'all wants to summarize that recommendation for us. Dr. Moore, you want to take that?
Sure. I mean, I think just reinforcing that the benefits of vaccination outweigh the risks, and really encouraging pregnant patients to get vaccinated. I know we've had an increase of pregnant moms in the ICU and other things here in Louisville. And so just really encouraging anyone over the age of 12 who is not vaccinated yet to go out and get vaccinated,
And
especially
for women,
in the middle of the surge.
Yeah, and for women that are worried about fertilization and vaccine and all that, where's the science telling us on that now?
So there are no studies that the vaccine causes infertility, but there are studies that COVID can. So if that is a side effect you're worried about, definitely recommend getting vaccinated.
Okay, good. All right, Dr. McDonald, any thoughts from you here before we go to the media?
No further thoughts. It's unfortunate that we're in this situation where kids are required to wear masks again. But again, what we have seen is, these masks prevented so much infection from usual viruses that we saw in the community. Influenza was non-existent this year for us in the pediatric world, and RSV, which usually is so high in the winter, was again non-existent. So masks work, and it's just where we're at with this pandemic. And pediatric patients still need to wear masks and prevent the spread in schools.
Thank you very much. Yes, sir. Dr. McKinney.
Mr. Mayor, I just was going to say that sort of to emphasize what Dr. Moyer had said, CDC had always favored immunization of pregnant women, but now they're, because of the newer data that come out that show total safety of the vaccine and no increase in miscarriages and people are immunized, that now they're urging pregnant women to get the vaccines. It's a very strong statement because the data are solid and the protection is very, very important.
Thank you for that. With that, Jess, why don't we move over to questions from the media?
Okay, thank you, Mayor. Our first question comes from Katrina Helmer with WDRB News. She says, U of L's Dr. Klein said this morning on the radio that he thinks we could be close to reaching the peak of this most recent surge. Could you put that in perspective with the case counts we're seeing now? And is there a way to anticipate when case numbers could start leveling off or going down? And Dr. Hartlage, we'll throw that one to you.
Thanks, Jess. So I hope that Dr. Klein is right, but at the moment, our trend is still upward. We do have about half of our population that is vaccinated, and so we would like to believe that those people have a good level, not perfect, but good level of protection against this Delta variant. So hopefully we will see cases start to slow, but at the moment, our numbers are still rising. And I would also remind folks that the hospitalization number goes up peaks about 2 weeks after the cases peak, and the death numbers peak about 2 weeks after that. So even if we get on the downturn of cases, we're not out of the woods yet either way.
Thanks, Dr. Hartlage. Our next question is for Dr. McDonald from Sarah Ladd with the Courier Journal. She asks, what is the average age of pediatric patient you're seeing? And are they primarily coming from Louisville?
Yes, primarily from Louisville, and really it's a range from 1 to 18 years, but half of them are young, below 12 years age, and half of them are above 12 years. So the average is probably about 12 years of age.
Thank you, Dr. McDonald. The next two questions in the chat are about hospital capacity. The first one comes from Paul Miles with WHAS Radio. He asks, Dr. Hartlage, can you give us any information on hospital and ICU capacity in the city? Also, is staffing having an effect on availability of beds in the city? And then Ellen Smith with WHAS asks, have there been any hospitals that have started turning away patients because of staffing or capacity problems? Dr. Hartlage, we'll start with you, and then if Dr. McKinney and Dr. McDonald want to chime in as well.
Yeah, so Paul, you hit the nail on the head that staffing is generally the first restriction in terms of bed availability. So hospitals are typically licensed for a certain number of beds and a certain number of ICU beds. And they often operate with less beds than that on the basis of nurses and other staff availability to care for the patients in those beds. So I do know that many of our facilities locally are struggling to find additional staff to open up extra beds. Our hospitals are not full, but they are fuller than usual. And I don't believe we've had anyone have to take measures like stopping elective procedures or turning patients away. But our hospitals are fuller than usual and are quite close to needing to take those steps. I know in other areas across the country that those are measures that have needed to be taken. So hopefully we can stem the tide here and not be in a position of delaying or denying other life-saving care for patients.
Doc, I
Dr.
can
Hartlage.
provide a little data on that if you want. On December the 1st, we had 391 hospitalized versus 259 today. So that was one of our higher periods around there. So you can see we've got more capacity if we have staff. A lot of the staff that is burned out and retired, I know, in different states around the country. And then in terms of ICU capacity on December 1st, we were at 99 versus 75 today. And then on ventilators on January 31st, we were at 71 versus 47 today. So we're about, what, 2/3, 3/4 of where we were before, assuming the same staff levels are there. But the trend up has been concerning here this month. On the 2nd of this month, we had 18 people on the vents versus 47 right now, and about half the number of people in ICU and hospitalized. So just in a very short period of time, you've seen a significant increase.
And I would also add that, when we had those very high hospital numbers back, 8 months ago, that we were looking at much less level of activity in the community. And so many of the other things for which patients are hospitalized were reduced. For example, we're still, our colleagues at University Hospital are still dealing with traumas and violence and other things that they have a new set for. Dr. McDonald, I'm sure can comment on the number of RSV patients, I'm sure in other situations that they're dealing with.
Yes, really the surge in our children's hospital is not from COVID. COVID is, like I said, about 10 patients a day, but it's been the surge of RSV in the community, which is at levels that we usually experience from November through February. So that's really the large number of patients. Now, the whole nation has experienced a nursing shortage, and that is an issue, but we are able to staff all of our beds at this time, and we are running at a higher capacity than we usually do this time, but it's something we're used to.
And Doc, can you remind us what RSV is?
Oh, respiratory syncytial virus. It's just a common virus transmitted by children, and it's usually affects children from newborn period through about 2 years of age. That's what most of the patients admitted with get. You and I might get a cold from it, but kids, younger kids, it affects more seriously.
Okay, and that is the last question in the chat.
All right. Well, with that, I'd like to thank Dr. McKinney and Dr. McDonald for joining us here today as we work through this new surge. We're hopeful we're toward the peak, but we just don't know. We have learned to be humble to this virus and continue to do so. But what we do know is that a vaccine and a mask will help no matter what. So please remember that at all times. We are pleased that we're seeing a little uptick in people getting the vaccine now. So we're hopeful that will continue to do so and make today the day. A lot of people are just saying, well, I wasn't quite ready. Or I didn't have my questions answered. So please make today today or get those questions answered and help us defeat this virus here in our great city of Louisville. So with that, thanks to everybody, and we'll look forward to talking to you again soon.